On what he's seeing on the ground in Texas, Dr. Pritesh Gandhi, a primary care physician in Austin, Texas. Dr. Gandhi, thanks so much for joining us. Have you seen a big pickup in patients in your hospital?
Absolutely. I work at a federally qualified health center. It's a nonprofit clinic on the east side of town. And well, last Friday, we had an emergency meeting in the evening where we decided to double the amount of capacity available for drive-through testing and double the amount of capacity to see patients who have respiratory symptoms. And the reason why we're doing that is that, look, as of last night, we have record hospitalizations here in the Austin area, record use of the ICU, and we're seeing the same thing in Houston. And so we are seeing this in real time, community transmission of coronavirus, and it's taxing our system.
What about the age ranges of your patients that are getting hospitalized? We're hearing a lot that it's younger people that have gone out and that are suffering right now. And if so, how are they faring once they are hospitalized?
Yeah, so it is certainly starting to skew younger. When this pandemic first started, I was seeing a whole host of folks that were 65 and older. And if I look at my clinic from last Monday, at least half of the patients I saw were younger, folks that were in their 20s, 30s, and 40s. Now, my understanding of what's happening in the hospital, because I work in an outpatient setting, is that, as we expect, folks in their 20s and 30s and 40s tend to fare better than folks in their late 40s, 50s, and 60s and onward. But it doesn't quite change this fundamental fact. Widespread transmission is occurring throughout the region, and there doesn't seem to be a plan coordinated either at the federal or state level to mitigate this.
Do you feel like the healthcare system across your city or your state, though, is prepared to deal with the levels of patients that you're seeing so far?
Yeah, it's a two-part answer here. I have confidence in my colleagues in medicine, nurses and social workers and physicians. We will do what it takes because we signed up for it. It's our obligation. But at the same time, folks are exhausted. On Monday when I showed up, right before I started to swab patients, I went and walked around our clinic to fire people up because folks are tired. The reality is that we are still reusing PPE in many of our community health center settings and in clinics across the region. So you marry this fact that we have a lack of supply of PPE. We have rising numbers in Houston and Austin in our hospitals and our outpatient clinics. And you've got a healthcare workforce that is overworked, understaffed, and doesn't have the appropriate protective equipment. It's a stressful time. But I believe in our colleagues here, and we will see this through.
Dr. Pritesh Gandhi, thank you for joining us. We appreciate the update.